Okay, so here we are for another episode of lerCONVERSATION. We have in the upper left Jeremy Adler. We have in the lower left Mark Malone with OrthoFreeze Plus, both of them. And then we have Dr. Lundquist, who's joining us as one of the users of this product. This is a conversation where we bring together manufacturers and clinicians that are using the product. How are you all doing today?
Doing great.
Awesome, man. Thank you for having us.
Absolutely. Real pleasure. Real pleasure. So I guess I'll start down here with Mark. Talk to me about OrthoFreeze Plus. Talk to me about, how you came about launching the product, and we'll go into the formulation a little bit later.
Great. Yeah, so basically I've been working in orthopedic physical therapy for over 30 years, and OrthoFreeze Plus was really born out of necessity. A lot of our patients that we work with are in constant pain. We've seen the pitfalls of the opioid crisis. And just over time, I started thinking there's got to be an alternative. So as I researched, I found that there were some other avenues that could still get the patients the pain relief they're looking for, but without a prescription necessary or without the fear of an addiction taking place. And it was really fortunate because I see probably 20 to 30 patients a day through my clinic. And so we had a kind of a captive audience to do a small pilot test with it. And the feedback was phenomenal. And so at that point, I knew we had a really great product. It was helping with things from joint pain to inflammation, neuropathy, bursitis. We were seeing a lot of different applications with it. So at that point, I knew we had a hot product, and it was just a matter of trying to get it into the right hands, the right physicians, the right patients. And so that's where we are now.
So Dr. Lundquist, I know you've actually had some experience using the product on your patients, and how did you come to learn about it, and in what situations you find it most effective?
Yeah, Rich. So I'm a practicing podiatrist, foot and ankle surgeon, and there are just a big subset of patients in our practices where we need really everything in the toolbox to throw at them. And so, I became aware of OrthoFreeze through, I think it was LinkedIn, and just saw some testimonials of what was going on. And I had these patients in my practice who weren't surgical candidates, who had a condition that was maybe lingering. We've tried everything. And so I started looking at topicals and started using it for a few of those patients that, there's really, I hate to say for lack of a better term, but there's not much else that we could do, and started seeing some really good benefit. I think my nurse, so I ordered the sample pack, and I think my nurse stole the biggest bottle that we got of it because her husband has chronic, hip and back pain. And she's loving it. Right. And then, so, the cases that I really concentrate on for OrthoFreeze are the plantar fasciitis patients that, you're throwing everything at them. And I tell all my plantar fasciitis patients that this is a tough condition to treat. It's a tough condition to have. I've had it personally. And so having OrthoFreeze with the topical lidocaine, the topical NSAID, having that to be able to put on a patient where you're really attacking that problem from all angles, found a lot of benefit. And then, there are those surgical conditions. I had a 90-year-old lady with massive bunions come into my practice, and she was just inflamed, and she hadn't had much pain up until about a year, but these are just really inflamed for her. And it wasn't something that was surgical, but we tried the OrthoFreeze for her, and she came in and she was 95% better after about 2 weeks of using it. And yeah, that's just an anecdotal case, but it's one of those things where, as a surgeon, there are a lot of things that we can correct, but there's a lot of things that we shouldn't correct. And this is one of those modalities that I think is great for patients.
Jeremy, in your travels and using this product and showing it and your role as a consultant, we're talking about a wide reach among various specialties where this will be applicable. What have you seen out in the field and some of the people you've talked to?
So when Mark approached me, and I love the way he wanted to approach selling this, is he wanted to focus on clinicians. He's a clinician himself. He wanted to find a guy that had some contacts that might help develop a distributor network of sorts. And I've got to say, we got chiropractors so far, surgeons, obviously the orthopedic surgeons, There's been a couple pain management docs as well. Athletic trainers for professional sports teams have been using this. That's kind of where we've gone so far, but there's so much further to go.
Dr. Lundquist, there's products that come across our desks all the time. Everybody's trying to sell something, show us something, but there's nothing really that different.
When I go and see my colleague, my doctor, my copay used to be $25, now it's $40. And so I'm already paying something to go see someone. And so when we have patients come in to see our clinicians, you know, the burden is on us to make sure we're maximizing that value. And you'll see us, you know, talking to patients through videos to try to get them as much information as they can. But also, when patients come in for a problem, a lot of times that's the start of a care journey, right? They see us for one visit, they're going to need to see us for another visit. And our commodity really in there is trust. Are they going to trust us? And so if we give them just a very cursory exam and it's like, there's a few things we can do, come on and see me next time. They've already paid a copay. They're paying for their insurance. They've gotten not much value from us. So this is one of those things that, you know, for my practice, I noticed that I was sending patients out the door with information, but sometimes not a lot of things that they could do to help their problem. And this is just one of those things that, you know, it's a topical anti-inflammatory. The drawbacks are very, very, very few. So when I say, hey, here's the information, this is your condition, here's what we're going to do, here's what you can do, let's start treating it with an orthotic, let's start treating it with a topical anti-inflammatory. A lot of people are starting to kind of push back on oral anti-inflammatories because there's more data coming out that may not be great for your gut. There's other things going on. So if we can treat them as specifically as possible, that's really our goal. So that's really why I looked at OrthoFreeze, because I was seeing value from my patients there that we were leaving on the table. And it's something that kind of filled a void. And, you know, as a surgeon, I know I'm going to operate on some people. I know that they're going to use OrthoFreeze and then need an operation. But I loved it when that bunion patient came back. And she's like, yeah, I'm 95% better. Like, awesome. You know,
that's amazing.
Hope we don't meet again.
Exactly. So, you know, we're talking about effectiveness. We're talking about market and reach and opportunity. When you developed the product and you looked at the specific parts that you need to put into it to make it happen, right? The ingredients. Talk about why this product is not another Me Too topical analgesic.
Well, I think, you know, there are some ingredients that are, well, I guess all the ingredients are known commodities. I think it's the formulation, if I'm being honest, you know, that you can get lidocaine, you can get Voltaren gel or diclofenac. It's available, but it's the formulation of that along with the CBD extract oil, which is also a natural anti-inflammatory. And I think it's just the way that it works in a synergistic fashion with the other ingredients. And sometimes you just catch lightning in a bottle, and this one seems to be doing that for us. In the formulation, I think it was just all of the right ingredients in the right compound. There's just something magical happening with it.
Yeah. How does a clinician who's interested in the product, a patient who's interested in a product, how do they obtain it?
Yep. So for clinicians, we've made it really easy. When you go to our website, which is orthofreeze.com, there's a physicians tab. As a physician, click on that. They can request a discount code for their patients. When we get that information, we set up a discount code for their patients. Then we send out samples and hand out brochures, information for their patients as well. And that way they've immediately got product that they can send with their patients so that they're getting something each time they come in for the visit. And we can also track through this discount code how this doctor's doing. If we're getting a lot of orders from Dr. Smith's patients, we know it because of the code. And so we can kind of give him or her feedback that, hey, you've got a lot of your folks really liking this, a lot of orders coming in. So we also have for retail customers, same thing. You go to the website, you can purchase it right there.
Okay.
We do usually ship the same day. If the orders come in before 4 o'clock, they go out. You get it within 2 to 3 business days, which is pretty quick turnaround. And we just figured that people that are ordering this product are in pain. And so we don't want to delay that. So we offer really quick shipping so that within 2 to 3 business days, they've got their product straight to their door. And then we also have representatives throughout the country who are also carrying it. And so we've had some physicians come on board through that but most of them reach out through our website, and then we connect with them and give them all the supplies and brochures that they need that way.